Are limited to 10 minutes each.
Thank you. Thank you, Mr. President. Mr. President, we have been talking on the Crapo amendment about the new taxes that are in this bill. And there are so many new taxes that it's really going to increase the cost of health care to every individual who has health insurance, and it will also tax the people who don't have health insurance, and it will tax the people who have too much health insurance. So the taxes in this bill are almost mind-boggling. Yesterday we talked about the cuts in Medicare. But we're also talking now about the $500 billion in tax increases, $500 billion of tax increases. And what Senator Crapo's amendment will do is to say that we want to go back to the promise that was made by the President that no one who makes under $200,000 or a couple who makes under $250,000 would have any tax increases. It just recommits the bill and takes out everything that would tax individuals at that level because the promise was made to the American people. So Senator Crapo's amendment would certainly affect those who have high benefit plans, which are going to have a 40% excise tax in this bill. If your plan is considered high benefit and you make under $200,000 a year, or you're a couple making under $250,000 a year, you should not have to pay because your benefits are better than the government has said they should be. So we would help the union member, for instance, because the unions do have high benefit plans. We would help those union members who are making under $125,000 a year or $200,000 a year if they're single, to just make sure that they are not going to pay a tax for having too much coverage. And then there are the individuals who have no coverage or too little coverage, who are going to have to pay an individual tax in this bill of $750. Surely, if someone can't afford to have health insurance, we should not be taxing them. Certainly not. So the Crapo bill will assure, the Crapo amendment would assure that when this goes back to the committee, that someone would not be subject to the individual mandated tax if they make under $125,000 a year, which they surely probably do, or if they have a high benefit plan and they make under that amount. It's just trying to say that that promise that the President made would be kept. But I'd like to also talk about another issue that is in this bill, and that is that you would think that the bill takes effect in 2014, so the taxes would take effect in 2014 as well, that everything is going to come together and start in 2014. That's what you would think. You would be wrong. That is not the case. In fact, the biggest part of the taxes in this bill will take effect next month, less than 1 month from now. The taxes that are going to increase the costs of health care premiums, prescription drugs, equipment that you would use for medical devices, the taxes start next month. So the bill imposes taxes for 4 years before any person would be able to sign up for any of the plans that are going to be available, presumably, under this bill. So let's walk through this. $22 billion in taxes on prescription drug manufacturers would start next month. $19 billion in taxes on medical device manufacturers next month. $60 billion in taxes on insurance companies across the board next month. So what's going to happen? Of course, the cost of all of those items will go up. Americans will start next month paying more in insurance premiums. Americans will pay more for their prescription drugs and more for their medical devices because those taxes start next month for supposed programs that are going to start in 2014. Well, maybe you would think that the benefits would start coming in 2011, 2012, 2013. Not at all. Nothing starts in benefits or programs until 2014. But there are more taxes that come before 2014. In 2013, the taxes on the high benefit plans take effect. $149 billion. This will affect union members, surely people making under $125,000. They will be affected starting in 2013, but any benefits from this bill would take effect a whole year later. The limit on itemized deductions for medical expenses is also changed. Under this bill, you would have to have 10% of your income before you could start deducting your medical expenses. Now, this is for people who have a terrible accident or a debilitating high-cost disease, cancer treatment, maybe a clinical trial. So present law is 7.5% of your income, and you can start deducting these expenses. But the new bill, starting in 2013, you have to go to 10% threshold before you can have those deductions. So that would be another $15 billion in taxes to individuals. And finally, in 2014, after 4 years of taxes and increases in premiums and medical devices and prescription drugs, then you would start seeing the rest of the bill take effect. So in 2014, you still have more taxes. $28 billion in employer taxes will start in 2014. Now, these are for employers that can't afford to meet the threshold of what they will have to cover for their employees, or individuals who cannot afford health care will have $8 billion in taxes, and that starts in 2014. So, Mr. President, I'm working with Senator Thune. There will be a Hutchison-Thune motion to recommit this bill that will say the taxes start when the implementation of the bill starts. I think that is just a matter of fairness. We want to recommit the bill and say everything should start at once. How can we tax people for 4 years, raise their prices on insurance premiums, raise their prices on drugs, raise their prices on medical devices when they get none of the opportunities that would be in this bill until 2014? So I'm going to be working with Senator Thune, Senator Grassley, Senator Hatch to try to make the corrections in this bill that would just present a fairness to the public, transparency and fairness to the public about what these taxes are and when they start, and then when the implementation of the program starts. It is so important that we have the ability to say to the American people, if this bill passes, you're not going to be taxed. Your prices are not going to go up. Your premiums are not going to go up any more than they already are, caused by the increased prices in this bill, at least until the bill is implemented. So we're going to try to do that for the American people in this bill very soon. So I'm very much looking forward to talking about this. You know, I talked to someone just last night that heard us starting to talk about the taxes in this bill, and they were astounded.
The senator's time has expired.
They were astounded. So, Mr. President, we're going to try to give relief to the American people and hope that we can have a bill that will truly not have the taxes and mandates that are there now that start 4 years before the bill is implemented. Thank you, Mr. President, and I yield the floor.
President.
Senator from Montana is recognized.
President, I yield 10 minutes to the Senator from Michigan.
Thank you very much, Mr. President. And
Senator from Michigan is recognized.
Thank you to our distinguished chairman. And first, Mr. President, I have 11 unanimous consent requests for committees to meet during